Hello, my name is Caleb Alexander. I am a third-year medical student at OSU's Cherokee Nation campus, and I'm going to present this project that I worked on with Lydia Brock, Dr. Greiner, and Dr. Hartwell regarding HPV and meningococcal vaccine uptake among teens, a cross-sectional examination from the National Immunization Survey of Teens in 2020. So a little background, vaccination against both human papillomavirus, or HPV, and meningococcal disease is recommended for all adolescents aged 11 to 12 years in the United States. And meningococcal conjugate vaccines became recommended for this age group in 2005, while quadrivalent HPV vaccines were first recommended for adolescent females in 2007 and males in 2011. Also, the National Immunization Survey expanded in 2006 to include the NIS teen, which was designed to gather more information about adolescent immunizations, including HPV and meningococcal vaccinations. So the objectives of our study, our primary aim was to analyze trends in vaccination for both HPV and meningococcal disease and determine factors associated with increased likelihood of dual vaccine uptake. And our secondary aim was to assess if states of residence influence likelihood of dual vaccination. We anticipated differences in individual and dual vaccination status based on teen demographics, and that teens living in states with vaccine mandates will exhibit higher rates of dual vaccination against both HPV and meningococcus compared to states without any mandates. So the methods that we used, we analyzed the data on 31,083 adolescents aged 13 to 17 years from the National Immunization Survey Teen 2020. Then we used bivariate and multivariate logistic regression models to determine dual vaccination rates and associations between vaccination status and sociodemographic characteristics. The results of our study, we found that teens were 2.03 times more likely to be vaccinated against meningococcal disease compared to HPV. Also, that teens vaccinated against HPV were 1.21 times more likely to be dually vaccinated than teens who were vaccinated against meningococcal disease. Among teens living in the South relative to the Northeast, the likelihood for being vaccinated against only HPV increased by a factor of 1.3, and against only meningococcal disease increased by a factor of 1.17. Further, relative to those living in the Northeast, the risk for being unvaccinated rather than dually vaccinated increased by a factor of 1.51 for those living in the Midwest, 1.62 for those living in the West, and 1.8 for those living in the South. We also found associations in vaccination status between sex, race and ethnicity, and income to poverty ratio. Continuing our results, we found that the states with the highest rate of dual vaccination against both HPV and meningococcal disease were Rhode Island, Massachusetts, South Dakota, Vermont, and Maine, all of which, besides South Dakota, are in that Northeast region. And then the states with the lowest rate of dual vaccination were Alabama, our state, Oklahoma, Alaska, Arkansas, and Montana, three of which are in that southern region. So some of our conclusions, we found that dual vaccination against HPV and meningococcal disease among adolescents in the United States is associated with many factors, including state legislation, physician recommendation, sex, and census region. And although administration of both vaccines is recommended by the Advisory Committee on Immunization Practices, or ACIP, to all adolescents aged 11 to 12 years, meningococcal vaccination is 2 times more likely than HPV vaccination. The significance of these findings are that given the retained efficacy and the guidance that both meningococcal ACWY and HPV vaccination series begin at ages 11 to 12 years, we recommend that primary care physicians encourage their patients to receive both of these vaccinations simultaneously. And given the similarities in disease prevalence, spread, and ACIP recommendations, HPV vaccine mandates may help reduce disease burden in the United States. Also, increased vaccination at a societal level will increase protection against preventable diseases that cause significant burden to adolescents and young adults. Here are our references, and here is my contact information, and you can email me here if you have any questions. Thanks.